So we're going to talk about hip impingement, and the couple forms of it. I had a patient ask me some questions about what her symptoms are and what they're actually coming from. So talking about some of the things that contribute to why people get groin or hip pain. So you have two components with hip impingement that typically feed into causing the symptoms. You can get a little bony spur on the rim of your pelvis, which is called a pincer lesion, or you can get that little spur on the neck of the femur, which is a cam lesion. So if we look up here at this poster and you see the skeleton, you have the shaft of your femur, you have this little piece called your femoral neck, which then attaches to the femoral head, which fits in the socket, right? So shaft, neck, femoral head. Now on that neck, what tends to happen is between the shaft of the femur and that ball, you can get a little extra bony growth on that neck, which makes that femoral neck a little bit thicker or a little bit wider. So as you're moving your hip joint through that socket, through different ranges of motion, you can have that little bony prominence press up against the rim of your pelvis, which can create a pinching or pain in the groin or anterior aspect of the hip. Now, the other piece to this is the pincer lesion, which can occur more so on the rim of that socket. So this is your acetabulum where the femur, that ball, fits in. On the rim of this, instead of this being like it is here, you can get a little bony prominence or bone spur that gets right on the rim of that surface, which also can feed into when the ball of your femur is moving around. As it comes up, especially into a position where your knee is coming up towards your chest, it can also hit a spot where it pinches the ball of that femur and this bone spur against each other, which can also create pain. Now the other piece is that inside this socket is something called your labrum. Your labrum is there to improve stability of a joint. You have one in your hip and you have one in your shoulder. It almost acts as a little bit of a suction to try and hold that femoral head in the right position as your hip is rotating and moving as you're doing activities. When that labrum tears, it can make your hip joint a little bit more unstable. But the other piece is if it's a small tear that peels off the lip of that surface, that tear can get pinched between that ball, that femur, and between this rim of your pelvis as you're moving your hip in certain directions. Specifically when you're doing things that compress your hip joint. So as I bring my knee up to my chest, ideally a normal feeling would be to feel maybe a little bit of stretch in the back of my hip because I'm lengthening those areas. Some people will feel it in their groin, right? Doesn't necessarily mean you have a labral tear, but if your hip joint is tight, the muscles or the capsule that surrounds the joint, as I take up all the slack in my tight hip, then I can get that same compression or pinching in the front of my groin. That can happen with the knee to chest motion. That can also happen with that knee up and coming across the body, which further you can see kind of compresses my femur against my pelvis. So some of the things that we work on are definitely not jamming our leg into feeling that sensation. But if anything, as I bring my leg up and across, I want to minimize what I feel here and get myself to feel more of a normal stretch. So one thing I have people do in sitting is I'll have them get up to that point where they start to feel the groin, back off a little, and then I have them press their knee into their hand to try and engage some activation of the muscles on the back side of their hip while it's in a little bit of a lengthened position to try and wake this up and get them to feel more awareness of that glute and some of the deep rotators in their hip to try and offload that compression that's occurring here. The other piece is that the muscles that come across the front of the hip are typically tight, your quad, your hip flexor. So the other concept is trying to loosen these structures by doing things that takes my foot behind me. I could put my foot on a surface like a stool or a chair and just very lightly squeeze my butt and tense my stomach to feel a light stretch here. If that doesn't stretch, I can take my foot a little further behind me. Sometimes I'll even have people press the top of their foot down into the chair or down into the stool because that helps me to feel more of a stretch or an awareness through my quad and hip flexor. Loosening that also, typically afterwards when I come into this position, will lessen that compression because now I have more mobility in the surrounding structures. So it's important to know that you can get the joint itself compressing and being pinched, or that labrum can be pinched between the two bony surfaces, especially if there is a small tear. It doesn't necessarily mean that you need to jump into surgery. It just means that you need to get more motion and stability around that hip. So as it's moving, those muscles are not compressing these underlying surfaces to create pain or pinching into the groin.